Welcome back to Between Two White Coats, a podcast designed to help you be the healthiest version of yourself. I'm Dr. Michelle Plaster, a family medicine doctor.
And I'm her co-host, Amber Foster, a family nurse practitioner. In our combined 30 years in medicine, we've seen a lot.
We're discussing key issues surrounding health and wellness, answering some of our biggest questions, overcoming health obstacles, and giving patient-centered advice in hopes of educating you and providing the tools you need to live a healthy life.
If you find our podcast helpful, please consider subscribing so you don't miss an episode. And don't forget to leave us a 5-star rating and review. This will help other people find our podcast.
Thanks for joining us. We look forward to serving you. Okay, Amber and I like to believe that we are quotable. I don't know if we're quotable or maybe repeatable, because many times I will come out of an exam room and I'll hear your MAs cracking up laughing or other nurse practitioners cracking up laughing, and they're like, "You will not believe what Amber just said." And then there are times where my medical assistant comes out and says, "I didn't realize you could say that." Yeah. And we speak freely.
Yes.
And we're very honest and transparent, and I believe that we have limited time with our patients. The dialogue that we have matters.
Some of it's rapport. Like, I know who I can be a mess with. Like, I always say that I'm not really professional. I try to be, even on the podcast, like, I'm really trying to pull myself together here, but then I just still am myself. And
this is maybe the buttoned up version of us,
right? Like, I tell patients, I will act this way in the room as I will act if I see you at the Walmart or any other store. Like, this is me. And it's really hard for me not to be this way.
Yeah, we're pretty
So
real.
I do say things, but of course, like, I try to be respectful for the most part, and I know who I can,
for the most part,
push the limit on a little bit. So we do say some hilarious things.
Yeah,
to patients.
we do. We say a lot of stuff. So we were talking about, wouldn't it be fun if we did a podcast around the things that we repeatedly say, or the things that we find ourselves saying repeatedly. And I was asking my medical assistants, like, what are the things, like, after we said that, I know there's things and I'll start with, I probably say this every day, but then I couldn't think of what are the things I say every day. And so my medical assistant was like, oh yeah, there's some stuff. Yeah. So we are going to share with you all the things that we repeat often, find ourselves saying.
Slightly inappropriate, maybe sarcastic.
Yes. Some of them are going to be fun. Some of them I hope will be quotable.
Yeah.
My goal one day is to be in one of those great books that sits on someone's toilet and it's like famous quotes.
Yeah.
And so it'll be like famous quotes from Michelle Plaster. So start with one. What's one of the first thing that comes to your mind on the things you say?
Which this often comes after when patients are choosing not to be compliant. Yeah. Okay. So this is where this would come in.
Yeah. And non-compliant is this horrible catchphrase of, you're not doing what we told you.
Like, yes.
But some people just truly aren't doing what they know they need to do.
Yes. And so this would come up and, like, this would be the conversation. Like, I will tell them, sometimes medicine is parenting. And sometimes I can see a big picture that you cannot see. Mm-hmm. And you have to trust me. And so I often will say medicine is parenting. Like, I feel like I'm talking to my 17-year-old.
I agree. Yeah.
And then also, I cannot care more about you than you care about you.
Oh, that is one. I was taught that by a attending physician when I was an intern doctor. And he said, don't ever find yourself caring more about an outcome than the patient.
So I'm like I'm stressing out for them.
Yeah.
I'm like, yes. Oh my goodness. And they're just like, well, it doesn't matter. I'm not going to do that. And I was like, so then at some point I have to be like, okay, well, that's your choice. And I'll see you back.
Yes.
Or I won't, because you're going to be dead. And I will often say that too.
And those are not just words. That is a life choice.
Yeah.
And I would encourage everyone to take that life choice, and no matter what you do.
Yes.
Do not be more invested in someone else's wellness, health choices than they are.
Yeah.
You will lose. And there are times where we see the outcome for our patients and we know it's horrible.
Yes.
There's times where I'm like, they're not going to be alive in a year.
Or they're going to lose their leg.
They're going to lose their leg. Something horrible is going to happen. And we could really stay up at night over that.
Yes.
But we can't change it.
No.
And
I really
so
want them to care.
I cannot care more about you than you care about yourself.
Yeah. I'll be like, you could die.
Oh, that's the most important.
Like, that's not fun.
Yeah, it is. So that is the most important.
That's several of them all at one time.
Yeah.
That I would typically say.
I have one that's maybe a little bit similar to that, and there's a different doctor style for different patients' needs.
Absolutely.
And sometimes I can fit all those things, and sometimes I'm not the right fit for people. My style is that I don't dictate and boss what to do. I don't feel like I'm the power in the room. It's your life.
Yeah.
And so I want you to care about your life, but indeed it is your life. And so I think one of the things that I frequently say is, you are the captain of your ship, and I'm just here to teach you how to sail.
Yeah.
And I think that's what I see my role as a physician and being is, I give you information, I give you tools, but then what you do with them is entirely up to you.
Yeah.
And in that, people will come in and they'll say, you're going to be so mad at me. I stopped taking that medicine. I was like, well, why'd you stop taking it? Because it made me so sick. I was like, well, you'd be kind of stupid to take something that's making you sick. Like, my goal is not to make you sick, nor should you keep doing something that's going to make you sick. Sometimes I might be a little bit frustrated that you didn't tell me for 4 months and your blood pressure and sugar's been high.
They'll tell me another reason that makes absolutely no sense. And I'm like, well, that's the dumbest thing I've ever heard. Like, so sometimes I'm like, you know what? That was really great. You probably should have done that and let me know. But then sometimes I'm like, well, that was dumb.
Well, and that's where it's like parenting.
Yeah.
Because sometimes you just have to say what they need to hear.
Yeah.
And like, that's dumb. What you're doing is dumb, and it's going to lead to
to
really bad
outcomes.
outcomes.
Yeah.
And smart people don't do things that lead to really horrible outcomes with their health and their life.
Yeah.
And so, that's the dumbest thing I've ever heard is feels like maybe not as professional as people think we should be.
Never, ever.
But all this being said, there are times where I can look at the person and we have to speak to the person that we're sitting in front of. And I think both of us read people really well. And so,
I'll hold their hands and tell them it's dumb.
Yeah. And so there are times where I'll say, I don't think that was your best judgment. And then there are times where it really is. I think that's the stupidest thing I've ever heard.
Yeah.
Because it's just depending on what's going to get through to them and what is going to help them to realize what they need to.
Yeah. I'm trying to think of some other ones. I always will say, and I don't know who initially said it. You probably can Google and find out. But I always say, you have a lot of problems until you have a health problem, and then you have one problem. Because if you get diagnosed with something, and it can completely change everything else that you're doing. You can be super worried about all kinds of things in life, but you get a bad diagnosis, you get something everything else stops.
Right. Everything else stops. I have one that I wrote down that I say all the time too. Your health is your most prized possession. If you don't know that, it's because you haven't been sick.
Yeah.
As soon as you are sick, you recognize that it is the one thing that matters most. Yeah. And it doesn't matter what else you have. If you get a terminal diagnosis, if you are fighting and you feel horrible and you're fighting a disease or whatever else. Yeah. So I do think that
we both had similar ones on that.
Yep. I do think that it is people's most prized possession, and I hope that you never have to realize that. But another thing I say all the time is we all leave this world the same way.
Yeah.
Our job is not to fight death, because guess what? We'd lose every time. Yeah. Our job is definitely to help cure disease and prevent the preventables and all of those things. But when people are really like, well, I'm never going to get sick and whatever, we all leave this world the same way. Yeah. Let's postpone it as long as we can. Let's have as much quality as long as we can. But I also think as doctors, that reminds me, as medical providers, that reminds me that we haven't failed when people get sick, because everybody gets sick at some point. We do the best we can. We prevent and we heal as much as we can. But I also don't think, I just had a conversation with one of our other nurse practitioners who really felt bad because she had seen a patient, and a few weeks later, the patient passed away from something 100% like a sudden cardiac death that there were no indications of 3 weeks earlier. And she's like, did I miss something? Is this my fault? And I'm like, of course it's not. Yeah. Of course it's not. And so, I think another little quotable is we all get out of here the same way. We all die. There's no way around that.
I often will say, swallow the pill. And some of that is sometimes I use other words.
Yeah, I think actually I've heard you say swallow the damn pill.
I've said that before too. Yes. So that was the edited version, but yes, the unedited version is not that. But because some of it is. Especially this tends to be more around the mental health arena, because people want to feel that they can be strong enough, and I love Jesus and I'm a believer, but they can pray enough, they can do all the other things to not have depression. And I'm like, it's okay. And we can revisit this. I'm not saying this is forever. I'm just saying swallow it for now, because you need it.
Yes. And we've talked about this medicine, and we've collectively agreed that this is the plan for you.
Yeah.
And you've looked at us and said, yes, I'm following through with this plan. And then something happens to you, you don't take your medicine.
Yes.
And sometimes, so I have a diabetic hypertensive who I mean, and most recent visit with him, I said, I love your wife so much, and it's going to make me so sad when she's a widow.
Yeah.
Quotable. Yes. Because, and I know you've said the same, but he does not take his medicine.
Like, increase your life insurance.
His blood pressure is 200 over 100. He feels okay, so he thinks it's okay. His A1C is 14. He feels okay. He thinks it's okay. This is a disastrous road that he is on, and it will end in short time.
Yeah.
And so I say to him, all those medicines that you're paying for that sit on your counter, they don't do a darn thing in the bottle.
Yeah.
They help no one in the bottle. Yeah. And it's the same idea. Swallow the pill. And if you're not going to, and if you're not on board with that plan, then you should tell us. But we find ourselves every day having at least one patient who's like, but I don't take it.
Yeah. And I am not.
I'm like, well, I can't help you with it if you're not going to take it.
And I'm not against like other modalities by any stretch. I would, and a lot of things I say, what you could actually do to fix this and not get a pill would be, how about diet and exercise? How do you feel about that? Like, I'm real sarcastic about that, because I'm like, I had a student with me recently, and she's like, goodness gracious, is all you treat high blood pressure and diabetes? I'm like, yeah, and you know how you can actually cure that?
Yeah.
Diet and exercise.
Like lifestyle.
And so so I say that a lot too. Like, I'll get a little sarcastic about that, because I'm like, you don't want the pill, but you also won't do anything else I ask you to do.
But and I 100% appreciate when people tell me I don't want that medicine.
Yeah.
And so that way we were never on the train of, you're going to take the medicine. Well, okay, let's go right to the other things.
Yeah.
Or when they look at me and go, I'm not going to take it. Well, great, don't go buy it.
Yeah.
But
what else can we do?
If you're looking at me and acting like this is the plan, then
please take the pill.
I might need you to do your part of the plan.
Yes. My medical assistant was like, oh Lord, please say this one, because you always say it. And it's also me. I say this in medicine and life, and just, I'm not always right, but I'm not usually wrong, which sounds awful.
I love it.
But I always will tell patients, like, I will tell you what I don't know and what I don't feel comfortable with. Like, I am definitely, I'm always, one thing I wrote down was get a second opinion. Like, I am not opposed to you seeing a specialist or talking to someone else. Sometimes I'll have patients that see me and I'm like, who you actually need to see is Dr. Plaster. And I'll have him make an appointment with you or another one of our physicians if I feel like I'm not sure, or I'll get your input, because I'm definitely not like I know everything. So that I'm saying,
and we've said that many times. Get a second opinion. We've told people in the podcast. We told our patients. But yeah, I think that's a quotable is, get a second opinion.
Get a second opinion, and I'm not always right, but like if I feel like there might be something wrong, then there probably is. And I sometimes I don't even know what that is. Like, I always say I have that like sixth sense, that gut instinct. And sometimes I'll send people and they're like, thank you so much. And I'm like, I don't even remember what I did, but it was because I sent them for a second opinion or something. I was like, hey, I don't know what's wrong, but something's wrong.
And have a medical provider who's willing to say, I don't know.
Yeah.
Sometimes there's the God complex and we feel like we know a lot. So then we get confused about a lot and everything. But have someone who will tell you, and don't lose faith in them when they say, I don't know, because then you'll know what they really know.
Yeah.
And so I love that. I'm not always right, but I'm not often wrong, because I'm going to say, I don't know before I'm going to tell you something that's blatantly wrong.
Yes.
Yeah. I love
that. And I'm
that.
always like, come on, like, let's follow up.
I'm going to adopt that one.
You could quote that
I'm
one,
stealing
sister.
that one. So I started in residency, leaving my house and saying, going to save lives. And I just say it all the time. So I will say to the staff, like at the end of the day, are we done saving all the lives?
Yeah.
Sometimes I am straight up saving people from strep throat.
Hey, that could be dangerous.
I'm doing an annual wellness visit and preventing diseases that don't exist yet. Still saving lives. I just saved them real early.
Yes, I like it.
But yeah, I love giving myself that level of self-importance and saving lives.
I like it. One thing I will often say, especially for things like colonoscopies that no one ever really wants to do, I'm like, I've ordered that and you're welcome. Like, I'm not like, this is an option. Like, would you like to have a colonoscopy? No. But it's
we've been doing this long enough to know that we no longer say, would you want? Yeah, no one wants.
No. So I'll just say,
are you willing to?
Yeah, so you're welcome. Like, you're 1,000% welcome.
Right, because we're saving lives.
Because I'm saving your lives.
Because I'm saving lives. One that I say, I think almost every day, sometimes people be like, oh, I went to the ER, I probably didn't need to, or I didn't know if I should go to the ER. And of course, call us, ask us questions, all these things. But I always say you're better to be at the ER and find out that you don't need to be there than to be at home and find out that you should have been at the hospital, because that's when things go south quickly. Yeah. And so, that is really my way of saying, if you're not sure, if you feel like there is some impending doom, get yourself to some help. And so, don't debate too long if you need to be in the emergency room. If you feel like there's something urgent or emergent going on, I'd rather you be in the ER and find out you're okay.
Yeah. Schedule an appointment, review something. Like, yeah, same.
Yeah. Better to
I'd
be at
rather
the
see
ER.
you and not really need to than been like, dadgummit, I wish you'd have been here 2 weeks ago.
Exactly. Better to be in medical care and find out you're okay than to not get medical care and find out you're not.
Yeah. I often will say to new patients, and I will say this, and you can say this as well, like, now we've been in practice long enough, and like for patients for me to have a new patient, usually it is a referral, like someone, like,
yeah,
because I am not.
People find us from their friends.
People find us and friends, and we have newer providers here that we're building their panels, and so to see me, you typically have to request me.
Yeah.
To see me, and so not because I'm more important or anything, but just because my schedule's full.
Because you're full.
And so I will tell patients often when I meet new patients, like, how did you hear about me? Because that often will tell me a lot. Who sent you? And then sometimes our first visits are a lot because, a lot of times people will wait, and then they find someone that they think they can trust because so-and-so sent them. And so then they kind of unload on us. And sometimes it takes more than that first visit to actually get what we need because it's so much. Yeah. And so I will often say to people, you don't know me, but you have to trust me. And the reason I say that is because now I might even tear up. Is because I did not realize when I chose this profession, that I really do care about people. Yeah. But sitting in seats with people I've been a nurse, I don't even know how many years. I just restarted for NP, so almost 16 years. But like, you sit with people in really hard spots. Yes. And so again,
and they tell you stuff that they've told no one.
No one. Yeah. And I mean, the other thing about family medicine is I know entirely too much about all y'all's family. So if my patients are listening, I know all your stuff. You just don't realize I know it. But
and we won't reveal it.
And I won't reveal it because it's HIPAA. Or so always I'm like, you can tell me anything. It's HIPAA. But sitting with people day in and day out, and listening and truly caring for people, like, I really want what's best for people.
Yeah. And it's heavy.
It's heavy. And so I feel so honored when people trust me. Yeah. And so new patients don't get that. I think that that's the rapport that I do try to build with people. But I'm like, you don't know me, but I do have your best interest at heart. Yeah. Now, it might sound like I'm a lot and I'm telling you to swallow your pill. And I will be that blunt with you, but I also really care about you. Yeah. And like, you really do have to trust me. And if you don't trust me, then I don't want you to see me. Yeah. I don't want to be your medical provider if you cannot, if you don't think I have your best interest at heart. Yes. And so like, now that I'm all teary, but that's like the one thing that I didn't realize how much I would truly care for people. Yeah. Throughout the years. And like, now I've had patients for 10 years. I've been here 10 years, March. Whoop, whoop. I'm going to tell John I need some new pairs of shoes because that has always been my joke with John.
Yes.
John, if you're listening, that's
it was supposed to be part of your benefits. Part of your benefits package was supposed to be a shoe allowance.
I'm a shoe allowance. I'm kidding. But like, to care for people for 10 years is saying something. Like, I have patients who I have loved. One patient in particular that recently passed away, and like, I was sobbing when her sweet little thing ended up. This sounds awful, but we get a lot of times we won't know. We get the sympathy cards from when we get notified from the hospital.
Yeah, we send cards to
and
people.
So we send cards, and so Rebecca puts it on our desk, and it's awful.
Cards will lay on our desk, and as we're walking up to the desk, we're like, "Oh no,
who died?" And so one of my very favorite little, I'm gonna shout out to her family, Miss Smith's family, but like, I loved her, and she would come in, and it didn't matter. She usually always got on my schedule because I would be like, I don't care, just put her on, like, I'll see her whenever. But like, I am on the phone sobbing with her daughter because I've loved her for so long. She's been like a little grandma. We talk about her jewelry, like, who cares about a heart failure? She always looked good. And like, that was one of the things that was fun with her. And
but so, I think you're emotional on this because, and I think this is why people will tell you stuff that they don't tell other people, is because you recognize what you're asking people to do. Yeah. You don't know me. We don't hang out outside of here. I'm not one of the people that you're going to put in your will. I am going to meet with you for 15, 30 minutes a few times a year and ask you to tell me the stuff that you don't tell anyone.
And then I got to fix it, try to help you fix it.
And then I want you to know that I'm on your team. Yeah. And then I care about you, and then I'm never going to do anything that might harm you. And we haven't had time to develop all of this relationship and this level of trust. Yeah. And so to know that in our brief periods of time have to be so intense that you have to learn to trust me. I just had a nurse practitioner a couple of days ago. She was a new patient to us. She's a retired nurse practitioner. She's been practicing in medicine for a really long time. And so when she met me, we were talking, and she said, I said to a friend that I hoped when I left this visit that I would have someone who was on my team. She's not sick or anything. She just understands the importance of having a relationship with a healthcare provider. Because we all leave this place the same way, and you're going to need to have that relationship.
At some point, you might interact with us. I almost said interfere.
That too, or we might interfere you.
We're interfering with you.
But she said, I told my friend that I hoped I would meet someone and develop a rapport with them and have a relationship with a medical provider that I would then want to get up and give a hug to at the end of the visit. And then we talked about a few other things. And then after the visit, I was like, do you want to hug me? And she was like, yes.
Yes, I do.
Yeah. And I was like, because I want to hug you too. Let's hug. But it was, she worked in the field and she understood that this is an important relationship.
Yeah.
It's a really important relationship. And that's not lost on you. We hear people's heavy stuff and the stories that what people go through in this life is remarkable.
Like, I'm asking you to do this or do that, and you may not understand. You don't understand the why or the reasoning. I just need you to trust me that I'm making the best decision for you.
Yeah. Yeah.
And that's hard.
So that leads me to probably what is my most serious one that
I did not even mean to make that what it is, but there we go.
But it is what it is. Yeah. What I've said to people so many times, and it typically ends up leading to tears in my eyes and theirs, is your life is meant to be more than this.
Yeah.
I think people go through this life and they don't realize. I say this a lot to people who are struggling with addiction. Many times we, the white coats, get really offended when people come in and try to push us for habit-forming meds. We feel like they're trying to play us. We feel like they're trying to whatever. I just let all of that go. I don't have any of those feelings. What's happening is there's a person who has a real disease in front of me that is addiction, and they need the medicines that they are addicted to because they know how they feel when they don't have them. And instead of fighting with them or instead of feeling like they're trying to weasel something out of me, I just let a second of silence and I say, your life is meant to be more than addiction. Your life is meant to be more than this. When people are depressed, when people are in bad places that they won't leave, when people are making choices that are not helpful to their wellness, and what we see it in physical, like when someone has anemia, when they have a gradual loss in their hemoglobin, they don't get really tired in one day. It becomes their new normal.
Yeah.
And so I think so many times we see people, and as they reveal what's going on in their lives, we realize, wow, you are tolerating so much. You are dealing with so much. You are so sad. You are in such a bad place, whether it be physically, mentally, or something else. And so, I say to a lot of people, and I believe it every single time, your life is meant to be more than this. You get this one life. And what are you doing with it? Yeah. And could we be doing something better? And can we partner with you to try to make that happen? I say, we've done an entire episode on polypharmacy. I say every single day to at least someone, doctors are great at starting medicines. We're horrible at stopping them. Yeah. So that's my little plug to always remember that you don't have to stay on this medicine forever.
Yeah.
And let me know if you want to come off of it, because I might forget when we're talking about all the other stuff that maybe we can stop some meds.
Yeah. I often will say, let's get it together. Let's get it together. I've even made people get it together notebooks.
Oh, I love it.
Yeah. And he did. And his wife was very grateful, and he's doing actually very, very good because he just needed someone to say, like, listen.
Yeah. And you got to get
together.
This. Yeah.
Yeah.
You can get it together.
Get it together notebooks.
I think my last one that is I've said it a trillion times, is listen to your body or it will speak louder.
Yeah.
I think that we try to deny things when we first get sick. We ignore stuff. It'll get better. And we don't listen to our bodies. And, most of the time we struggle through this life and we don't feel our bodies. It's okay. But when you feel something, that is your body telling you something. And I promise if you ignore it long enough, it will speak louder.
And I often will tell patients too, like, patients are usually right. And if there's if they feel like something is off, often there is. Like, it is not like, it's not just them being depressed or anxious or a hypochondriac, like that. Often patients are right. And so it's just a matter of figuring it out. And sometimes that takes more than one visit, which I know can be frustrating. But I'm like, listen, I believe you. Let me try to help you and try to dig in. So, like, yeah, if not, it just keeps speaking louder.
Yeah. And this one's not my quote. I have a coffee mug that someone gave me that says, "Don't mistake your Google search with my medical degree."
Yeah, I like that one.
But I do say it every once in a while. And I never mind when people Google search. It's great. Advocate for yourself. And many times people come in and they say things and I'm like, "Whew, that's smart. Let's look into that." But when you Google search something and it gives you some ideas, that should be the beginning of a conversation with a professional. That should not be you then taking it from there to figure out how to treat yourself. Take that information and do good things with it. I think I will end this episode with the quote that I love quotes. I'm a quote person. This is why one day I wish to be in a quote book. But I think that the quote that I've been sharing the most and saying the most, the quote I've loved my entire life is "Be the change that you want to see in the world," which is a Gandhi quote. But the one that I've been saying the most, which is why we built the Wellness Center, is a Desmond Tutu quote and I'll read it to make sure I get it exactly right. There comes a point when you need to stop just pulling people out of the river. We need to go upstream and find out why they're falling in. And so I find myself recently saying to a lot of people, let's go upstream. Yeah. Let's figure out why people are getting sick. Let's figure out why you're getting sick. Let's really get to the core of this instead of just having to pull
constantly
everyone or one person over and over out of the river.
Yeah.
And so these are the things we say, whether we should or not is probably an episode for another
Ask our
day.
patients.
But there we do find ourselves, we've been doing these jobs for almost 20 years each. And I've been over 20 years and you're probably, And so we're both over 20 years of working in healthcare. And so we've found that there are certain things that we say often.
All the time. And I mean it. I mean it when I'm saying it too.
That's exactly right. That's right. And I say it repeatedly because I think it's smart. So I'm like, ooh, that sounded good. I'm going to say that again.
Do that to the next guy.
That's right. So those are the things that we say. Hopefully you found some entertainment and maybe even you can carry one of those things away. And if you write a book with famous quotes and you would like to put me in it.
Yes, go right on ahead.
I welcome that opportunity.
Give us the dedication to page.
Yes. Thank you so much for joining us today. We appreciate you. And until next time, take care of yourself. We like to leave you on a good note. So here's today's Tell Me Something Good. Something good is extended family. Not the people who you see every day, but the people who you get excited to see because it's not an everyday privilege. Also, the family you choose. This may be the people that you call aunt and uncle and they're really no relation whatsoever. But these extended people who treat and love us like family and our extended family, they are something good. Thank you for joining us today, and until next time, take care of yourself.